This is Dr. Amanda with StraightSmile Solutions, and today we're going to be talking about different types of brackets and how to pick the right biomaterial for your bracket for your case. And I know I work with a lot of general and pediatric dentists who are just getting started with brackets and wires, straight wire for the first time, and it can be super overwhelming understanding all the variables that are out there and picking the right bracket for your patient and for your office. So I just kind of want to go over it just really on a high level, so hopefully you can understand it. So let's talk about the three major biomaterials for brackets and the pros and cons. So three major biomaterials are going to be metal, ceramic, and composite plastic. Okay, so metal is kind of like what you see here, your standard metal. White ones will either be made of ceramic or plastic. Okay, so within those categories of your metal, ceramic, and plastic, you have your regular mini twin brackets for the most part and your self-ligating brackets. So mini twins are the ones that are going to use the little ties here, these little rubber O-rings to ligate it. You just have to stretch them and put them on and take them off, really easy. Simple, easy to learn, lower cost, okay? Self-ligating are always going to be more expensive. These are the ones that have the trap door, like right here, that you're going to have to open, okay, and then shut each time you change a wire. So pros of the mini twin is that it's cheaper and easier to take in and out, but these little rubber O-rings that are here, okay, these degrade over time. So it's a little bit more of an undulating force, a variable force level. You're going to put them on, they're going to feel tight, and then over time they're going to kind of relax and they're going to have to be changed. So frequency at the beginning, most people change them every 6 to 10 weeks or so, maybe around 8 being average. So initially you'll be seeing these patients between 6 and 10 weeks. If you do self-ligating, the pros are that you don't have anything to change. Nothing has to be changed. So if as long as you're keeping in the same wire, you can go a greater interval in between appointments, assuming that you put the brackets on correctly, and everything will actually go faster in self-ligating, but you pay more, right? And then sometimes patients want colors, so self-ligating doesn't have colors. That kind of defeats the purpose. So many things to think about. So a lot of doctors, they see the pros in the self-ligating is that there's less appointments, right? And things get done a little faster because there's less appointments. But it's also more expensive and there's no colors. So sometimes they might charge a little bit more, or sometimes they just give these to their older patients. So we talked about that. Okay, so self-ligating brackets, right? We talked about that. They have the little trap door. Some of the branded names are like Damon, Speed, Smart Clip. Again, price point is I'd say at least 3 times. And I'm just giving like random prices of brackets. There's so many prices out there depending on if you're buying in bulk or volume. So I mean, like a couple dollars per bracket for regular mini twin brackets, regular brackets, and then like 3 times the price for a self-ligating. So maybe somewhere around 10-ish per bracket for self-ligating, 10 to 15, whereas like 2 or 3, $4 for a mini twin. You know, I'm assuming you're buying these in bulk though. So it is a big price difference. Now the doctors that I work with who are using indirect bonding and they're going to the labs, or they're using 6-month smiles, or they're using one of the partner labs that I work with that are charging around $300 for the setup, that price is for the metal mini twin. So that $300, that includes the trays, the treatment plan, and the brackets in the trays. So that's pretty good, you know. That's not bad. If you're doing the clear, it's going to be a little bit more. I think it's around $450. I don't know that any of them are offering the self-ligating at this time, but that's still something you could do on your own. Okay, so advantages, we talked about the advantages of self-ligating brackets being that it's less appointments, less often they need to be at the chair, overall shorter treatment time. Some people think it's less friction because it is like smooth and polished and there's no rubber that it's sliding against. So, you know, those are some of the benefits. And people say that it's a little more engaged because it like snaps down and there's no rubber, but I'm not sure about that. Mostly I would say definitely less appointments, slightly less treatment time. I'm really not sure why we have improved infection control. I'm not sure about that one that was on there. But anyways, disadvantages, those little trap doors can totally break. If you don't know how to close them, you can bend them and they're expensive to replace, and they are expensive, yeah. So let's talk a little bit more now that we've talked about self-ligating brackets versus traditional mini twin brackets. Let's talk about metal brackets and the advantages of those. So advantages is that they're cheap. Theoretically, you can recycle them, but I do know some doctors that sterilize them in between patients. I think that's gross, but I think more Like, I just have an issue with that. There's something wrong with it, and a lot of people do it. I just think that's wrong. Um, but from, like, let's say you have on your patient, let's say you wanted to take the bracket off and move it to a slightly different position. Or if the patient knocks it off and you need to put it back on, for the most part, the metal ones on the same patient, you can just, like sandblast the back or drill off the adhesive on the back, and you can reuse it on the same patient. So that's the benefit of that. Um, let's see what else. Metal ones generally have really good sliding mechanics, so things tend to go faster than with ceramic, for the most part. Not that expensive, and I don't know. I've seen all kinds of junky metal ones. So it says they resist deformation and fracture. I've definitely seen a lot of them deform. And, there's higher quality ones and lower quality ones. And over time, you'll kind of learn what's what. Over time, they can corrode. I've never seen them stain teeth, so I don't know about that. Okay, so main things to look at when you're picking a bracket: look at the bracket base, flip it over. You want to have really good retention. There should be a really good mesh in there so it can, grip good. So you can definitely like look closely at it. It should look pretty complicated when you look at the back of it. Look at it up close, right? Different things about the metal. This is things you could just ask, but I do know that the best ones are usually MIM, metal injection molded. The cast ones are junk. Don't get these. These things, like, they bend and they distort. These are the cheap ones. Even the milled ones are not so good from my experience. They're just not as accurate. So I would definitely ask if yours are MIM. I think it's better. All right, let's go on to aesthetic brackets or clear or white brackets, okay? So these are either going to be plastics or ceramics. So the cheaper ones are the plastic, the more expensive ones are ceramic. Plastic has a not so great. They stain more, they don't slide as well, they tend to get deformed and broken more. People think ceramic would get broken, but actually these have better sliding mechanics. They look way nicer. These are much prettier. They're very pretty. When you look at them, they don't, like, they look translucent, so they much less noticeable than these. So, and for the most part, that's pretty much all you need to know. I always would go with ceramic, but then the downside of ceramic, you're going to see in a second, is that they can fracture, right? And they're harder to get off. So many things to think about, right? Okay, so let's talk about the composite or the plastic brackets. If you're using 6-month smiles, these are plastic brackets. You tend to not be able to make complex prescriptions built into them. They're real simple, so you're not going to get really complex movements like torque and stuff. So the outcomes are not quite as good. So it's great for anterior alignment, but not good for comprehensive alignment. So most orthodontists are not going to use plastic. They're going to use the ceramic, okay? So again, issues are staining, lack of strength, more likely to break off. They can't express more complex movements that automatically come with it. So things to keep in mind, okay? Ceramic brackets, we talked about this. Definitely, I mean, if I had a choice, I'll always use metal over ceramics. And usually most patients that want ceramics, I'm just going to try to talk them into aligners because it's just way easier to deal with. But occasionally you get people who are old school that still really want ceramic brackets. So whatever, it is what it is. So issues can be some friction. Of course, if you have ceramic brackets opposing a natural tooth, it's going to wear the natural tooth. So you have to think wisely about picking the right cases for this. Of course, they're very expensive. They look pretty though. And also the other issue is they're really hard to get off. They bond really, really secure. So they're really hard to remove. And there's a trick to removing them. And sometimes they take some tooth structure with them when you remove them. So you have to, I would never let an assistant take ceramic brackets off unless they knew what they were doing. Okay, so yeah, we talked about abrasion, enamel wear. Ceramics are 7 times harder than enamel, so you just have to watch out, right? So bond strength is super strong. Watch out what type of teeth. I wouldn't want to bond them to cracked teeth or teeth with caries or anything with teeth with thin enamel, heavily restored teeth, because when you get them off, you might break the tooth and then you're responsible if you break the tooth. So it does make me a little bit nervous. I pick my cases very wisely to bond ceramics too, okay? Again, we talked about enamel fracture, debonding. Oh, other thing, yes, when you're debonding patients with ceramics, you have to wear safety glasses. The patient has to wear safety glasses, the operator, the doctor, the assistant, because it can shoot in your eye really badly and it can go down your throat. So you have to watch out. Okay. Mini twin brackets, your traditional metal brackets, are pretty easy to get in. Yeah, pretty simple. All right, let's talk a little bit about, lastly, about slot size, 018 versus 022. That's something that can be a little overwhelming initially when you're picking your bracket. Doctors get all very confused. You know, it really just comes down to personal preference. So obviously, if you're using an 018 slot, there's less wires you can use because you're going to fill that slot way quicker, right? So you're going to probably need to stock more wires if you do that. Whereas an 022, sorry, you're going to have to stock more wires if you have 022 versus 018. 018 is going to be less wires, so that's the benefit. But it can be a little harder to get the wires in 018 unless you're experienced to do it. So I would say most general dentists do go with 022 because it's just easier to tie in. It's more forgiving, a little less discomfort to the patient initially because you're not filling the slot as easier. There's more slop. So, but either way, you can go with either way. I think mostly you want to just give it a shot and see how it feels. See what it feels like to tie it in. But I believe most systems that are out there for general dentists are 022 slot. Most orthodontists, I think, use 018. So I was trained on 022 in residency, then I switched to 018. So I just got used to it, but I can use either. I just have to know what the slot is, and I'm just thinking of things differently, okay? Lastly, real lightly, we're going to talk about different bracket prescriptions. Just to explain, I mean, this can get super complicated again for general dentists and pediatric dentists, but for the most part, there's a ton of different prescriptions out there, and I really don't even worry about it. Like, obviously, you want to have a prescription. In the olden days, you had to put all the bends in the wires in order to get them to move. Now you just buy the brackets with everything prescribed in the slot. It does the work for you. So the most two common ones are going to be your Roth and your MBT. To me, I can't tell the difference. If I look at one case or another, I have no idea. I'm happy with either. I don't care. It all looks good to me. So, you know, I wouldn't worry about it. But I mean, if you are buying a IDB system, you should ask what type of brackets it is. The main thing that you have to keep in mind is you need to keep it consistent. So if you get a transfer case in, you don't want to take a transfer case unless their prescription that they use on that patient matches your prescription. Because if the patient breaks a bracket, then it's not going to look right. You can't piecemeal. So you can't use some brackets from a Roth and some brackets from a MBT and some you don't know, because it's just not going to work out. Things aren't going to look symmetrical. So you always have to keep it consistent. So I usually recommend a patient, anytime that you get a transfer patient that's not your patient that you put the braces on, that you just take them off and put your own on. And that's usually what most people do. I know patients get upset about this, but unless they're like done and you're about to take them off, there's a good chance that they're going to break something. And unless you know that your prescription matches what the other doctor did, and odds are it's not, because there's tons of different prescriptions out there and brands, that you're going to have trouble later. And then you're going to have to re-bracket the whole case, which is going to get expensive. So now if you can get a copy of their records and find out what prescription they use and you can match it, that's a different story. So just things to think about. That's the most complicated part, right? So again, this is the Roth prescription, a little bit about Roth. It came out in 1979. So some people say that Roth has better torque and stuff like that. I don't think most people are going to notice the difference. MBT is another one. It stands for McBennett or McLaughlin Bennett treatment or something like that. Slightly different shape of the brackets, but for the most part, some people think that this one's better. I mean, I don't think it really matters, right? An offset is just a little bit about the counter rotation that's built in. This is more of an issue having to do with extraction cases, so I wouldn't worry about that. Yeah, that's it. That's all about brackets. So hopefully that's a high level explanation for you. If you have any questions, please do visit StraightSmileSolutions.com and we'll be glad to answer your questions. All right, thanks so much.